Well, there is a lot of excitement within our medical impact team as a full update to our online ultrasound training is set to be released very soon. As someone who answers a lot of calls and emails from staff at pregnancy centers, I know that we very often get questions about the types of ultrasound training that we offer here at Heartbeat. And I love that I can bring up not just one, but a couple different ways that we can offer this training. So we're going to hear a little bit about that today. And before I introduce our guest, I want to mention that our sponsor today is Heartbeat International's Online Academy. So whether you're looking for training and resources as a director, a board member, medical professional, client advocate, or other staff member, I want to encourage you to check out the Academy. There's over 350 courses available and growing, and we really offer something for everyone. There's currently over 7,000 active students. So if you'd like to browse those courses and check out some of those resources, visit heartbeatservices.org and click on Store. Make sure to log in as an affiliate to receive your 20% discount. Well, I'm here today with two colleagues from Heartbeat International. They're in from out of town at our Heartbeat office, and they are just a joy to work with. We have Christa Brown, who's the director of our medical impact team, and we have Tammy Stearns, who is our ultrasound consultant for Heartbeat. Christa, tell me a little bit about your background in the pregnancy help movement and how you came to us here at Heartbeat.
Sure. So I started a long time ago, back in the 90s, working in pregnancy help. And then I worked for more than 20 years in centers. Eventually our centers became medical, and I was the director of 3 medical clinics. And then I also helped open new centers in 7 other states. And then in late 2017, I came to Heartbeat International as a medical specialist. And then later, I became the director of medical impact. So I help affiliates with their medical questions and help produce items that will help our medical affiliates with their services. And then I also oversee the Abortion Pill Rescue Network, which is a hotline and a network of providers that help women reverse their chemical abortions.
So not busy at all, right?
No, not at all.
And Tammy, how about you? Tell me a little bit about your background in ultrasound and also some ministry work that you do.
Absolutely. I started ultrasound, over 20 years ago. I started as a sonographer, a clinical sonographer, and ended up being in the educational side of sonography. So I directed an accredited ultrasound program for almost 20 years. And really felt like God was calling me to something different. Started volunteering in a pregnancy care center, and that was where God had his plans for me. So ended up quitting my job as an educator in ultrasound and went to volunteer with the pregnancy care center. And then within about 6 months, I was hired on staff there and deployed their medical mobile unit, and absolutely loved it. I love seeing how ultrasound just brings imagery to life. I love how a mother can be told that it's just tissue, and then when we show her a picture of her baby, she sees life for the very first time. We have a privilege to do that, so it's so exciting to me. During that time, also developed some educational programs within the center. And then God did an amazing thing with our family. He moved us to Nicaragua. And I remember my very first thought was, God, can I commute? Because I loved what I did. And about 3 years later, God gave me the opportunity to come and work with Heartbeat International. So in a way, he gave me the opportunity to commute. And it's just been incredible to be able to bring education to those that want to learn ultrasound. And that's truly where my passion lies.
That's awesome. From what I've heard, you're both really good instructors. So I've never sat in on the ultrasound classes during Pregnancy Help Institute or conference, but I get to hear the nurses as they're coming out of those classes, and I can tell you there's some good comments about you. So you're doing good things. Let's start off and talk about this brand new edition of our ultrasound training that we have offered through Heartbeat Academy. Now, we have had ultrasound training for a couple of years, and Christa, you were just saying, when did that first launch?
Yeah, that was launched in April of 2018, and it's been very successful, very well received. But we knew that updates were needed, and during that time, we've also, as a team, really tried to come together to think of things that would have helped us in our early days of scanning. And so not just the didactic that's required, but what would help you in a pregnancy help clinic? What would help in that setting? And so one of the things is really preparing the imager for the front lines, because that's where you are when you're scanning. And so you might think, why do there need to be devotions in this? Why does there need to be self-care information? But that's what these sonographers are doing. That's what these medical professionals are doing in the centers. They're on the front lines. Each of us that are instructors on the training, each of us have been there, and we know the fight that can happen. We know the limitations in budget. We know the struggles, the stress involved, and we've tried to incorporate modules that will help you not only with the didactic learning that you need, but also that spiritual strength that you're going to need as you walk through clients. It is, like Tammy said, it's an honor and a privilege to get to show life to these women, to these families. And ultrasound is so powerful. It's a powerful tool in the center, bringing truth to every woman, offering her all the information that she needs to make the best choice for her child, for her family. Ultrasound is just one component of that, of course, but it is a powerful component. So this new training, a lot of exciting additions. We have image review for the sonographer for 1 full year, community calls with sonographer trainers and other students. All the handouts are available. It's self-paced for the busy medical professionals. So we see a lot of people finishing a course in the middle, late at night or in the middle of a weekend. We know that everyone is very busy, and so this can be at your own pace. And one of the parts I really love about this also is that, at Heartbeat International, we really stress the love approach, an approach to how we care for our clients. But with this, we also tried to think about the love approach with each of these medical professionals that will be taking this. I feel like it's ingrained to everything, all of our materials at Heartbeat International, but we really hope that everyone that takes this course feels all that effort that we put into this, that we really do care about each of them, and we want to be available to them also. So yes, it's self-paced, and yes, you can complete all of this online, but we want to be available for questions and assistance as needed.
Yeah, I think that self-paced question is one of the things I hear the most. A lot of times with trainings, there's logging in at a certain time and there's live meetings, but this is a little bit different. It's all tied to a login account. So I think the cool thing is people can do this training at home, or they can do it at the center. Basically, anywhere they have a network connection, they can log in and keep plugging away at that training. So some of them get it done really quickly, but they do have quite a bit of time to continue working on it at their own pace, at their own schedule. So that's a really helpful part of this course and all of our academy courses. Tammy, do you have anything to add to that?
One of the unique things about the program is it is open for 6 months, so they can go back and review and go back through the material. One of the things I think we hear from a lot of our nurses and imagers that have gone through our other programs is, I didn't realize this was so spiritual, and that's exactly what Christa said. A lot of times medical, even in our centers, medical is divided, it's separated from the other part of the centers. And so it's our desire to bring everybody together, and it's a more holistic approach. And then that way we can serve our clients better.
Mm-hmm. And I know that that's something that you add to those trainings a lot, is that spiritual side. It's not just about the body. We care about body and soul. And there's different ways to share the gospel during that ultrasound session. Can you talk about that a little bit?
Absolutely. It's so important for us not to lose the idea of that we literally are watching God knit the baby in this client's womb right as we're scanning. And I think a lot of times if we aren't careful, we lose it to the scientific terms. It's the crown rump length. It's trying to find that perfect image. It's being worried that maybe we can't find the cervix or the ovaries or whatever you're looking for. And I think a lot of times we take that burden on ourselves instead of turning it over to God. And one thing that we know, that He is the one that will move mountains, and He's the one that will help work through this client's life. He can affect her in ways that we can't. So it's important, and it's one thing that we teach our participants that are going through our program, is to pray while they're scanning, is to pray before they scan. Such a spiritual battle. One of the things that I think is funny, we've had a couple people when we've done programs stop us and say, well, I thought this was an ultrasound program. And it's like, It is. But as Christa said, you're on the front lines. If you're not ready spiritually, this is going to be one of the hardest endeavors you've ever done. But what we have seen is we have seen God equips who he calls. And there are some that would say that ultrasound isn't for everybody. Not everybody can learn ultrasound. We don't believe that. We believe that if God has called you, that God will equip you, and you will be able to be successful in that journey.
So along those lines, who is this designed for? So what are some of the backgrounds that we need a nurse or a medical professional to have in order to enroll in this course?
We're looking for RNs, registered nurses, and also sonographers. Sometimes we have sonographers that have been out of maybe obstetrics for a while. This would be a good course for them. Even sonographers, I know when I came into working at pregnancy centers, I was trained as a medical sonographer in the hospital. It's different when you start scanning at the pregnancy centers. So it would be great for a sonographer to go through this training in order to help with their skills, but also to help them realize what the movement is about and the purpose of the scan. The idea is to be able to get the necessary information, but the real purpose of the scan is for her to see their baby. So that's one of the things that we work on. It's also open to other medical professionals. So we're looking for licensed professionals, physical therapists, LPNs, anyone that the medical director of that specific center has deemed able to do ultrasounds is welcome to take the course.
All right. Christa, do you want to talk about the instructors to the course? Because although this is self-paced, we don't just enroll you and leave you hanging. You actually get access to the Heartbeat Medical Impact team. So if you'd like to tell us a little bit about some of the other instructors that are involved, some of the people that you can reach out to at Heartbeat as you're going through this course.
Sure. So besides Tammy, we have one other ultrasound specialist, and that is Brian. And Brian Williams is out of Missouri, and he is another instructor on this course. And then we also have 3 RNs, 3 nurses, and they also have scanned-in centers. And so they are other 3 instructors. We felt it was important to bring in some foundations of nursing into the training. We also have our general counsel, Daniel White, taught a couple modules about policies and procedures and some legal concerns that centers or individuals may have in scanning in centers. And then we also pulled in other Heartbeat International staff. We didn't let a lot of people go by. We have Cindy Boston, Betty McDowell, our vice presidents of Heartbeat International. They did some devotions for us. Jarrell Godsey, our president, did some introductions. So we included a lot of the Heartbeat team as well as the entire medical impact team. And the medical impact team is available for questions, as you said, as those that are taking this course have questions. And like we said, we also have some community calls and some other interaction where you can talk to other students and the instructors.
Now, the way that this course works is that they are enrolled in the didactic portion. So they're doing online course training modules. And then after those are completed, there's the hands-on scanning portion. Do one of you want to talk about that?
I think this is what makes our program unique. We wanted to empower the centers to be able to train their own imagers. In the past, centers would have to either bring somebody in or would have to send their imagers off to have hands-on training. So the idea was to take A1's guidelines at what they say. And it suggested that either an RDMS sonographer, a physician, or an RN that has completed A1 training that can also be a trainer. So the idea is instead of having to take on the medical expense and send somebody to get trained far away or to bring somebody into your clinic, you utilize the resources that you have. We've seen this be successful. We've seen this, especially during this time, as a way that centers are able to go ahead and train RNs during this time without having to leave. We've also seen the benefit that they train on their own machine. When you go to other places to train, you're not on your own equipment, and then when you go back, it makes it more difficult. Also, they're training in their own culture of their center. As we know, every center is completely different. So this allows training to happen within the center.
Now, I know we talked a lot about the spiritual side of this, and then there's also the side I know I've taken a peek at some of the content on the course, and they talk about physics, and they talk about the science and the technology behind it. Christa, can you tell me some of the modules, maybe the titles or some of the objectives in this course? What will they be learning that they can then use in the hands-on portion?
Sure. So each module, there are 10 modules altogether. Each one consists of presentations, discussion questions, and assignments. And then there's also some video instruction, some video demonstration, which is an exciting addition to this training. And so it starts with the power of seeing, limited obstetric ultrasound for the registered nurse, the physics of ultrasound, which Brian teaches. It sounds intimidating, and he does a very good job of breaking it down, making it very interesting. Pelvic and obstetric anatomy, obstetric ultrasound, normal variants and atypical findings, abortion pill reversal and ultrasound, legal and ethical issues, self-care in the imager, and then the clinical competencies.
So Christa, I know there's a cost tied to this. Can you tell me a bit about that, and if there are any affiliate discounts?
Sure. So the cost is $495, but for Heartbeat affiliates, the cost is $395. And as Tammy mentioned, that includes 6 months of access to this course. So you can complete the didactic portion. I think the importance of that is that as you are doing your clinical training, as the hands-on training, it would be wonderful to be able to go back. Maybe when you heard that module, you listened to that module and you thought, I don't fully understand that, but I understand that they probably know what they're talking about. And then you do your hands-on, it starts to sort of come together. It's fit together. And so you can go back and rewatch modules and relearn some of that information. And every module also has handouts that are available to you. So you can either save those or print those. Those are available.
One of the things that I think will be interesting about this course is it has a discussion section. So the idea is you're not going through this journey alone. Yes, it is self-paced, but there will be discussion questions that the colleagues will be discussing items together, and you'll be able to learn from the experiences of other people. And I think that'll be really exciting. We also have our own stories. So as Christa mentioned, who's on our medical impact team, we also bring in our own stories of scanning and things that we've gone through in real life, and in hopes of being able to just impart some of the experience that we've had.
Tammy, how would someone get more information about ultrasound in pregnancy help clinics, whether it's this training or just ultrasound questions in general?
Well, obviously they call you, yes. Yes, they can call Heartbeat International and you will be able to direct them. Also, we have our Medical Matters that goes out every month and they can get more information on ultrasound. I highly recommend affiliates. We have a lot of nurses that'll come through our programs and they've never heard of our Medical Matters. And in each Medical Matters, articles are about ultrasound, specific to ultrasound scanning. So I highly recommend if they don't have that to do that. Also, there'll be more information at our annual conference, at our PHIs, or they can contact the Medical Impact team.
Yeah, and Medical Matters is a complimentary e-news publication that goes out each month. So if you're an affiliate, you should be signed up for that. All of your nurses and medical staff, even your director can sign up for it, so you can all be in the loop on the most current things and topics in medical services at pregnancy help organizations. And that's a great way to stay up to date on the trainings that we're offering. You'll know exactly when this is released, this new ultrasound course is released. And let's talk a little bit about some of the other ways that we teach ultrasound here at Heartbeat. Christa, what are some of the other opportunities that they have in person?
So in person, we have training every year at our annual conference. So this year we will be offering hands-on clinical training as one of our in-depth days. And we also have other ultrasound workshops available at conference. And then every summer we do Pregnancy Help Institute. We offer that. And that also offers some hands-on training. So also in Academy, we have a number of ultrasound courses that are available. Each of these courses also offers continuing education for our nurses through California Board of Nursing. So as you are trying to obtain your CEUs, it's wonderful that you're able to get courses that are applicable to your actual calling, to your actual work that you do every day. So there are other CEUs out there that you can do, but these are amazing because these are teachings that you can apply to your work every day in a pregnancy help clinic.
Yeah, and you can actually go straight to heartbeatservices.org for any of these resources, if you click on Store up at the top page on the toolbar, we have all of our courses listed there, but you can click on a category that's called Medical, and that will take you to a listing of all of our medical resources. You can sign up for medical matters, and also just feel free to contact Heartbeat if you have questions on any of those resources.
We also offer refreshers for RN. So once they've gone through this initial program, there's a refresher course that they can take. It's recommended that there's a yearly refresher course. Again, we want to empower the centers to be able to do it in their own center. So this gives them the opportunity to do the refresher. There's also a clinical component to it, and it also will cut down on costs for travel for them to have to go somewhere else.
All right, well, we know that we have listeners right now who some of them have had ultrasound services at their clinic for quite some time now, and maybe are just looking to enroll some new nurses in to do some new and refreshed training. And others might be thinking, we've been considering going ultrasound for a while and we haven't known quite how to start. It seems kind of intimidating. What would you say to them about getting started with this type of service?
I would just want to encourage them, if God has given them the nudge of putting ultrasound in their centers, or someone else the nudge to learn ultrasound, to go ahead and trust Him and try. This is a unique program in the fact that you do not walk this journey alone. It's got a spiritual component to it. We will be praying for you. If there's questions, you can contact any one of us and we will help you through it. There's a lot of people out there, I think, that God is speaking to them, a lot of nurses that have retired, or a lot of LPNs that have retired, or sonographers that have retired, that God is nudging them to do ultrasound in order to show life. And I would just encourage them to go ahead and give it a try.
And Heartbeat International has a number of materials. We have manuals. We have a lot of training beyond this ultrasound training available. And then we have our entire medical impact team that is always available for those questions, like Tammy said.
Yeah, we actually just this year published the new edition of Medical Essentials, which is the training manual. It's great if you already have medical services or you're looking to start medical services. It's really a great how-to guide, and it also directs you back to that medical team. They're always really good at answering those questions that you have. Be happy to talk on the phone or through email. So I want to thank you, Christa, and thank you, Tammy, for joining us today and talking about this new training. We're really excited to launch it here very soon. I want to thank you to the listeners, and if you would like more information on any of the things we talked about today, I'm going to add some links on heartbeatinternational.org/podcast. And if you have questions, comments, feedback of any kind, you can email me at support@heartbeatinternational.org, and I can connect you with the medical team, or if there's something I can help you out with, I'm always happy to help. And again, this episode is presented to you by Heartbeat Academy, so visit heartbeatservices.org to find out more.